You should get more evidence today of the crisis in our health system. I mean, COVID shone a light on a hopelessly dysfunctional, fragmented, under-resourced, understaffed health service and brought us to the brink. But all that dysfunction, that fragmentation, that lack of resources and staffing are coming back to bite us very, very quickly after COVID, with ED departments overrun again and so on. What we saw in North Kerry CAMHS, which is very widespread. So why are we failing to recruit and retain the staff that are necessary in order to provide the health service that we need? I mean, one problem I would put to you is, I mean, when I asked Minister Donnelly for a review of the over-medication of children in CAMHS because of the lack of staff last April, he did not answer the question directly, but bounced it on to the HSE, who then gave me a pro forma answer saying there wouldn't be a review, right? I asked a question in April for a general review of the over-medication of young people in CAMHS because of the lack of staffing, which I believe is widespread, not limited to North Kerry, last April. Stephen Donnelly, and this is standard practice when you ask the Department of Health of anything, says, I'm not answering this question, I'll bang it on to the HSE, because they're responsible, which begs the question, what is the Department of Health responsible for? What is the Minister for Health responsible for? And then the HSE give me a pro forma answer saying, we're not going to do a review. And then we have a scandal like the one in North Kerry. So don't you think the lack of a proper, integrated, properly governed health service is part of the reason nobody wants to work?
Deputy Boyd Barrett raised issues in terms of the health, and he said it was a chronic lack of resourcing and the difficulty to recruit. And you use the phrase, nobody wants to work in the service. Well, there's 132,000 people working in the service, Deputy. 132,000. And since January of 2020, there has been a record recruitment to the health service. Net 12,500. Gross 30,000 plus 32,000 recruited, because there's people leaving at different times, retirements and so on like that. To stand still, it has to recruit 9,500 a year. So it's not true to say that nobody wants to work in the health service. The numbers are increasing every year. That's the right way to do it. And it's a vast, vast service now, and a very extended one. And likewise, the investment has gone up very, very significantly. Billions in the last number of years, and particularly in the last 2 years, in terms of huge, significant funding gone into the base of the HSE to provide additional services. And reforms are happening also in respect of primary care, community care, home care packages, gone up 2.7 million hours per year, gone up by 2.7 million. 55,000 families now being provided with home care packages. That's been a dramatic increase from previous years. You should acknowledge that. And there are challenges and there are pressures, particularly in emergency departments, which are legacy, emerging from COVID, delayed diagnosis, people not presenting during COVID, elective care being cancelled during COVID, diagnostics being cancelled. All know that's going to have an impact over the next 12 months, unfortunately. Particularly what clinicians are saying is over 75-year-olds are presenting more ill and sicker than they would have prior to COVID been presenting in that manner. So these are challenges that we have to deal with. Clinicians are responsible for treatment in terms of prescribing. That is clear. That much is clear. Where you have junior doctors in position, there should be proper oversight and clinical oversight in respect of that. And that was not the case from the evidence presented by the independent review of Kerry South CAMHS. But I think fundamentally it's clinicians who have their accountability chain as well in terms of the medical council and so on, who are responsible for prescription and policy and treatment of individuals, and every individual is different and every case can be different.